Come on, buddy. He's just forgotten to breathe.
Come on, buddy. Let's just move him into surgery. That might get him breathing again.
Let's go. Oh, now you start breathing.
Now you start breathing, buddy. Come on.
Hey, Laura, who you got there?
This is little Oat. He's just come in.
Oh, buddy. You look sad.
Back home in Australia on a break from his London base, Scott has been called into action at the Sydney Dogs and Cats Home.
Have a look at his bottom. It's not good.
Oh, really?
Scott is being assisted by colleague Audrey to treat the badly neglected chihuahua stray.
Ooh,
Oh,
that is a big, nasty lump, buddy.
wow. That is nasty. That's massive.
I've seen a lot of lumps in my time, but this one looks horrible, it's ulcerated, and it looks painful, and I really feel sorry for little Oat.
I know you're busy.
Yeah.
Is there anything you can do to help with that?
Oh, no worries. Well, yeah, absolutely. We'll do our best.
Thank you so much.
Buddy.
Come here, little man. Come on, man. All right.
Oh, there's some nasty teeth in there, and that smell.
Whoa, he's got some shocking breath.
Oh, buddy.
Someone's not been brushing their teeth, have they? Oat's breath is disgusting, and when you look inside you can see he's got some really nasty teeth. The severity of Oat's symptoms means surgery that we're going to have to perform. Sad that someone's decided to dump him at such a ripe old age. Poor little man, he must be so confused and disoriented.
It's really sad when they have them for so long and they just give them up.
Yeah.
You're
Well,
sweet.
two things that has to happen. Are you going to do the bum, or should I do the mouth, or should you do the mouth and I'll do the bum? Neither of them are pleasant jobs.
Scissors, paper, stone.
Go on then.
Scissors, paper, stone.
Oh, scissors, paper, stone. No way! Scissors, paper, stone. Oh, bum. Which one do you want?
Bum.
Okay, right, I'll do the
I'm
mouth.
doing your butt.
I think I got out of that quite well.
I chose to remove the bum lump because one, I like surgery, and two, it actually smells way less down at his bottom end compared to his teeth.
Good boy, all right. Brave boy, it's okay, it's okay. Good boy. Have a little snooze, yeah? I'll sort you out. It's okay, thank you. Yes, I love you too. It's very concerning as a vet when you see an old dog that needs a lot of procedures doing. Anesthetics are always risky.
Suddenly, Oat stops breathing.
Buddy, stop breath holding. Just got to breathe for him. You can see his heart.
Audrey must artificially breathe for the aging chihuahua, desperately hoping he'll resuscitate.
Come on, buddy. Let's just move him into surgery. That might get him breathing again.
Scott and Audrey abandoned plans to x-ray Oat. They must operate immediately and finish their procedures as quickly as possible.
Walk him through. Oh, now you start breathing.
Now you start breathing, buddy. Come on.
When it comes to patients like Oat who are elderly and have a number of conditions, with Oat we just need to get in there and get the job done.
And he's such a sweet boy.
It really is.
We need to find him a good home.
Yeah, I'm just glad he's breathing again. Nasty looking thing, isn't it?
Oh, it's gross. It is quite superficial though, so I'm happy about that. So I'm just slowly going underneath the lump and hopefully we can get all of it out. How's the head end going?
Oh, honestly, it's a dentist's worst nightmare. There's a lot of teeth coming out. There's another one.
It's just coming out.
They're just falling out.
Oh, it's so rotten in his head.
I've seen teeth like this many times in rescue dogs. Unfortunately, it's just one of the many parts of the dogs that are neglected.
It's out.
Oh, well
Look
done.
at that. That's an ugly looking lump.
Yeah, as if the bum wasn't ugly, that made it worse. I'm glad it's out though.
Look at that, teamwork.
It's great. Well, look, this guy is going to be so much happier, I think, with all we've done. You've removed his nasty lump, and I've removed a whole bunch of nasty teeth.
Yep, he's going to be feeling good on the front end and the back end.
Yeah, so hopefully it's just a case of him now living as much life as he has left. I suppose the challenge of treating a rescue animal or an abandoned animal is you just have no history. So you don't know how long they've been suffering with certain symptoms, you don't know how fast things have grown. So it does make things a little bit difficult because you are flying blind.
And as much as I love you, Scott, I've got to go to an emergency.
Oh, okay.
No rest for the wicked.
No,
So
all right.
I'm going to leave you to recover him.
Sure.
Tell
Okay,
him I
fine.
love him, and I'll see you soon.
I will.
All right.
And you're leaving me with all the mess.
Yeah, clean up for me.
All right, great.
All right, see
Thanks.
ya.
Bye, Audrey.
Bye.
Check ya.
I've really enjoyed working with Scott. It's not very often that the Bondi Vet team comes together.
You all right, buddy? Hey? Ooh, your breath is so much better now. You can give everyone kisses, can't you? Hey, good boy. Let's go and put you in your bed. Come on then, gorgeous. Here we go, little man. Hey, you can go and have an old man nap. Hey, Mike.
How you doing? Good, mate. Out of this horrible rain.
With Oat in recovery, Scott has headed to Bondi Beach for a consult with Mike, a local lifesaver at his 5-year-old foster pug.
Nina was really depressed into herself, but over the last few weeks she's really come out of her shell. She's turned into a most amazing dog. She's so sweet, so docile, so friendly, just the perfect dog.
So tell us, how'd you get hold of this gorgeous little creature?
I applied to be a foster carer, and half an hour later had a urgent phone call to come and pick her up because she wasn't very settled down there, unfortunately. She was a little bit distressed.
Pugs are fantastic little dogs. They've got great personalities, but unfortunately they have a bunch of physical abnormalities that have been bred into this particular breed, which really don't do them any justice at all. One thing I noticed straight away is just she pretty much has no nose whatsoever. Also, you can just see her nostrils are basically like little slits. So there's just not a huge amount of air that she can breathe in with every breath, and that's why she's actually making quite a lot of noise even at rest. Is she making constant noise when she's walking?
Yeah, you get these, I call them puggy grumbles, and you know, you can hear them a mile off, particularly when she's sleeping. She's got this snore that will wake up half of Sydney.
Yeah, she sounds a little bit like a broken washing machine, doesn't she?
Yeah, definitely.
Hey, with legs.
But she's worth it, very cute.
Oh, she's very cute. All right, well, should we have a little run around and just see how she goes?
Sure, no worries. Yeah, come on, good girl.
Scott wants to see how exercise affects Nina's breathing.
Good girl.
If she struggles, she might need surgery to correct her respiratory issues.
Good girl.
Yeah, pugs aren't really built for exercise. You see, she straight away wants to sit down after one round. All right, Nina, I think you've had enough. Come on, sweetheart. Come back here. Come on then.
Come on.
Good girl. Yeah, there's your happy place. Very noisy, isn't she? Yeah. I think what we need to do is just unravel some of the physical abnormalities that she's been bred with in order to give her a comfortable and healthy life. All right. I do think, unfortunately, that surgery is in her future.
For sure.
Yeah.
Come on.
Mike and Nina are now heading to a Sydney rescue facility for possible surgery to correct the little dog's chronic breathing problems.
Come on.
Hey, Laura, how you doing? You all right?
Hello,
Good to
Scott,
see ya.
welcome. Thank you for coming.
Before examining Nina, Scott meets head vet Laura, who's flat out treating dozens of abandoned animals being looked after at Sydney's only charity pound.
I know how busy you are, and I'm adding to that because I met Nina when I was walking along
Our beautiful
Bondi
little
Beach.
pug.
Oh my gosh,
Is she
she's so
gorgeous?
gorgeous.
I know.
But personality, yes. Physically,
Body
could do
needs
better.
some work. Yeah.
Yeah. Hey, Mike, how you doing?
Hey,
You
good,
all right?
Scott. Good, thanks.
Hi, Nina. Hi, baby. Hello, gorgeous. How are ya? Mwah. You okay? Hey. Still super noisy.
Yeah, she's...
Come on in. Let's have a little examination. It's great to have Nina in a clinical environment so I can examine her properly. And what's very clear is she is the standard pug in that she doesn't have a nose and as a result has a lot of physical abnormalities. So she's got a lot of skin folds around her face. But the main thing is the abnormal breathing. facial abnormality, which is what it is so significant that she's actually got an overshot jaw, so her jaws are open. So I'm just going to have a listen to her chest just to make sure that that noise isn't anything else but the abnormality around her nose. The BOAS syndrome, brachycephalic obstructive airway syndrome, is produced because of this sort of extreme breeding. It must be so stressful and anxiety causing to have something in the way of your ability to breathe at all times. So good news is her heart is perfectly fine. All the noise is associated with inspiration. So every time it's unbelievable, honestly. You know, that is, it's quite the snore. But I suppose it maybe blocks the sound that you make, maybe.
Yeah,
when you're sleeping. So, you know, you can blame it on the dog. So what we're going to have to do in this case is two things. Take a little V shape out of here. And what it does is it flares the nostril out. So she'll have two sutures here and here. And we just go pop, like that, pop. And then reduce the size of the soft palates. But I couldn't change that personality because you're so gorgeous and so sweet. And that's the thing is, you know, she is such a sweet-natured dog, so it's definitely not her personality that's led to her not having a home. It's got to be that all of these issues became too much for their former owner. So Mike, you're brave enough to put her in my hands and maybe go for surgery?
Let's do it, I trust you.
Yeah, all right, mate.
Good. The work on the nose is going to be interesting, so I'm curious about her recovery, and I'm super worried about the surgery, but I can tell with Scott she's in really good hands.
Good girl. Come on then. Good girl.
Before operating, Scott and Nina are waiting for an important member of the surgical team to arrive.
Hey Audrey, how you doing?
Good. How
This little wrinkly creature is Nina.
Hi Nina, you are a bit wrinkly. There's a lot going on here.
There's a lot. Have a listen.
That is very loud. It's a bit noisy. Are you snoring constantly?
Yeah.
Yeah.
When I first meet Nina, I can hear her breathing is very, very loud. It's really concerning, and I'm worried that she's struggling to even get any oxygen into her system. I can see why Scott is worried.
So we need to do the BOAS surgery.
Okay.
I definitely think she needs to have her soft palate shortened, and we need to sort out that nose as well.
Yeah, there's not much air going through that nose, is it?
No.
Hey Nina.
It's awesome having Audrey here with me working on Nina. It's great to have just two minds to make sure that we perform the best job that we possibly can on our patient.
Oh no, lots of medications, eh?
As Audrey gets Nina ready for surgery, she gives the 5-year-old pug a taste of what's to come if the operation is a success.
How you getting on, ladies? All good?
Good, all ready for you, Dr. Scott.
You're looking very sleepy. Are you enjoying that oxygen? Probably the first time she's had decent oxygen her whole life.
Yeah, this is the best feeling.
Welcome to a world where you can breathe. Well, you'll be welcome to that when you wake up.
I'll hold your head. All right.
Go a bit more oxygen.
Yeah.
I'm going to come in front of you, Jeff. That's it, good girl. Come on. So in order to perform this surgery, I basically need to be able to see down and into the throat. So it does mean we have to kind of set her up in a very awkward looking way that I can then see what I need to see. That's pretty perfect there.
Yeah.
Yep. Uber large, soft palate.
Wow.
I've removed many soft palates from brachycephalic or flat-faced dogs, but Nina's, comparative to her size, is absolutely massive, probably the biggest I've ever seen. It's very concerning because if you get it wrong, we can cause Nina more harm than good. And you can see just how big this thing is. Look at that. I mean, it is absolutely huge.
Scott and Audrey are about to remove a section of Nina's soft palate.
So Audrey, this is where our working relationship goes to the next level.
Wow.
I actually need you to kind of give me a surgical hug.
Okay.
That's
behind?
okay. From behind. So I'm asking you to do that because I need someone to hold the soft palate out. So then I can see exactly the horrificness of this soft palate and exactly how much I can remove. Thank you, Audrey. Okay, it's just so big. It's got its own postcode.
I'm so excited to be working with Scott today. He's a fantastic vet and he's a lot of fun. And it's always good to work with other vets and learn their different types of skills.
There we go. And there we have it.
There's the culprit.
It's massive. There we go, soft palate resection done, and I'm really happy. It looks good.
Yeah, it looks amazing. Good job.
You can see an airway.
Yeah.
All right, now on to the nostrils.
Nostril time.
After removing part of what was blocking Nina's ability to breathe, Scott and Audrey will now try to increase the amount of air she can inhale through her nose.
Her nostrils are really narrow, but by taking a little triangle at the tops of each one and flaring them out, she should be able to breathe a lot easier. So last stitch there, Aud.
That's great, much more open.
Yeah. This is going to make a massive difference to Nina's quality of life.
She already sounds better.
Yeah, it'll be really interesting to hear how she sounds when she wakes up.
Yeah, exactly.
And that, my friends, is that.
Good job. All done.
Good job.
Wake up time.
Yeah.
Scott's finished reconstructing her soft palate and her nose, and I think when Nina wakes up, she's not going to know herself. She's going to be able to live a happy life and not struggle to breathe every single day.
Nina, hello baby girl, how are you? Oh, listen to that, the sound of silence.
Nina's ready to go home, and anxious foster carer Mike can't wait to see the little pug he's fallen in love with.
Good girl. Come on then. Good girl. Okay. No rush. There we go. Look, who's this?
Hello. Hello.
Who's this?
Come on.
Who's that guy? Yeah?
Hello.
Good girl.
How you
Well, she's
doing?
done really, really well today.
Oh, brilliant.
And I think the big thing is, what can you hear?
Yeah.
Okay. So there's already a massive improvement in the sounds that she's not making. Over the coming days, you'll hear that noise getting less and less and less.
I think
She's so happy. Yeah.
she's a bit stoned at the moment. It's a bit,
Yeah, she's a little bit.
still.
Okay. All right, Mike. Well, it's been great to meet you.
I think she's got to sleep here.
All right. Well, let me pick her up for you. Come on, baby. Right into Mike's arms. There you go.
There you go.
All right.
Go on, sweetheart.
All the very best, buddy. Nice to meet you. And
Thank you, Scott. Really appreciate it.
all the very best to you, gorgeous girl. See you later. I'm very hopeful that Nina's going to enjoy a very bright future. Now that her breathing is going to be so much better, that's going to mean that she can enjoy the great outdoors, possibly a little bit of surf lifesaving. Who knows? Bye-bye. All right. This place is amazing.
After operating on Nina and Oat at the Sydney Dogs and Cats Home, today Scott has come to the western outskirts of the city to help a colleague with a very special feline.
It is an amazing place. So, okay, there's the cats.
Well, yeah, they are. Just sort of supersized.
You're a vet, you know they're cats. Yeah, there you go.
Today I've been invited out to Zambi Wildlife Retreat by Rob. I've just arrived at my cat house call and I've now seen the cats and they're a little bigger than I expected. So what's our patient's name?
Masai. He's an African lion, 18 years old and in a little bit of trouble with the leg.
Okay, all right, well, should we go and take a look?
Let's do that. Zambi Wildlife Retreat is a place for animals to have a forever home. When they're finished in circuses or even zoos, they can come here, literally a retirement home for wild animals. Okay, come in. This is our boy. This is Masai. He's been caged up so we can do our work on him.
Wow.
He's very happy to see you, I see.
No, he's not. He's really, whoa!
So of course we can't go in and have a feel, as you know. Even with a tame animal, if you hit the bad spot, you'll get eaten, so we won't do that. Masai is lame, very lame, has not responded to drug therapy. So now it's time to x-ray and see what else we can do for him. Scott is a really top vet. I just love his work. He's coming down here to help me, and we'll see if we can find out what's wrong.
I don't want to touch the sore bit when he's already this bad.
Go get the tranquilizer.
I think that's what's needed. Yeah.
Zambi team leader Jess will shoot a dart loaded with anaesthetic into Masai to render him unconscious.
Oh, good shot. Well done.
It takes several minutes for Masai to succumb to the powerful drug.
Going to check him with the big stick.
Very technical.
Rob must be certain the dangerous predator is not a threat before the veterinary team enters the lion's den.
How's the poking going there, Rob?
He's going to sleep. He's not getting up, not trying to chew the stick and that. So I'm just going to go and check him now.
Stepping into Masai's enclosure, he's nice and sleepy. He's been limping on his right foreleg, and so we wanted to assess the joints and see what's going on. The possibilities are osteoarthritis, ingrown toenails, sore pads, or possibly even bone cancer.
Okay, let's have a feel of that leg. You'll get the idea of the power, eh?
Oh my God, the weight of it.
Just the leg.
It's just amazing.
How are his toes, do you think?
Yeah, so I'm just checking on the nails because I assume just like a domestic cat.
They do ingrow.
You're
quite right.
Are they all
okay?
Yeah, so that all looks good to me. I'm just going to have a look at his pad. Wow, look at that. Isn't that just awesome? Examining Masai, I'm just blown away. I mean, he is massive. They're just so big to be close to. And to be able to assess him from top to toe, can't get any better than that. Sure, there's no foreign bodies, there's no abscesses, there's no injury. That all seems fine, so it does seem like we're probably looking at a joint issue, maybe. There's a bit of clicking going on here in the carpal joint. There's actually a bit of grinding as well. Yeah, I mean...
Just a dear old man, isn't he?
He is.
Dear old man. We're worried it could be bone cancer. That would be terrible if it's that. It would be the demise of this lion, but we'll see if there's arthritis in those joints. Scott's already told me that's a very thick joint in the elbow, so we'll concentrate there.
Yeah.
1, 2, 3,
go. Oh, gosh.
Here we go.
That is a lot of feline.
The team moves Masai into position so they can begin x-raying the joints in his lame leg.
So we'll start at the foot and work our way up.
Yep.
They hope the scans will reveal what's causing his debilitating limp.
So when you're ready...
Wow.
Got
That's
it?
amazing.
That's all right. We've got the joint and we've got some arthritis in that joint, I think.
Yeah.
Let's
Doesn't
do
look
a
too
flex.
bad.
That's all right. You ready?
Yep.
Scott and Rob x-ray every joint in the old lion's troublesome leg.
Go.
Okay.
Okay, let's get his head back.
Okay, Jeff.
Watch it.
Good
He's
man.
like, get up, go back.
It's quite nerve-wracking. Performing this kind of procedure on a lion, you just have to keep your wits about you and keep very vigilant. We could see that Masai was starting to wake up. It's quite difficult to manipulate such a large beast. He is making a few scary noises.
I'll hold him.
Sit.
Or go. Go, you get the X-ray machine.
Got to have, yeah, it's just his head there. Yep. Okay, so.
Hurry. It's waking up.
Intramuscularly.
Intramuscular first, yeah.
Yep.
With the team now in danger, Scott gives their growling patient more anaesthetic.
Okay.
Good.
Yep.
Time.
So it's been 18 minutes.
Okay.
Scott and Rob quickly take one last x-ray.
Okay, that should be good. Okay, amazing. Okay, all right, let's have a look.
What's going on there? Just looks a little bit unusual there, doesn't it?
There's a loss of calcification at that point. So I think the one thing we can see there is definitely loss of bone density.
And a lot more arthritic changes and spurs and...
This is osteoarthritic change up here. So classic joints of an old cat, but at least it doesn't look like cancer. Taking the x-rays and then looking at the images in the den, yes, there are some arthritic changes there, classic symptoms of older joints, but thankfully no sign of cancer. Good news.
He's okay with sore joints. Leave him alone.
We're not going to put him down yet. Nor you.
Relieved at the diagnosis,
Still nice and sleepy.
Scott gives the ageing lion medication for his chronic arthritis.
Right, here we go. So this is the painful bit. The injection to Masai is a long-acting steroidal anti-inflammatory, and right into the joint like that, it should have a relatively long action.
Beautiful. Well done.
Yeah, poor lad, hey? Old boys and their sore joints. Do I need to do yours now?
I think so.
Yeah, up again. There you go. Wow.
Before his rare chance to be so close to the king of the jungle is over, Scott has one final task he'd like to undertake.
Whilst he's sleepy like that, can we have a quick look at his teeth?
Yeah.
Yeah, sure.
Just be careful.
Look at them. My gosh, what an insane set of chompers. Every single part of his anatomy is awesome.
I know this is something you've got experience in, but like must be every time you get to do this, it feels like such a privilege.
Never ever stops being so special.
Yeah.
It really doesn't.
Yeah.
No, you're right.
It's amazing.
Gorgeous animal. Beautiful.
That was absolutely epic. You know, to be able to put your hands on a living, breathing lion and to be a vet and to be able to do it and then help them as well, it's an absolute privilege. It's wake up time, mate. It's been a privilege to be your vet. Yes, it has.
I'll come back and check Masai to see if the injection is making a big difference. We've put in 2 vials of Depomedrol in there. Hopefully that will really help that joint settle down, get the inflammation out, and then we'll try and maintain him with some other oral drugs as well. See if we can just give him a better life.
Done. There we go. Everyone got their fingers? Everyone counted them?
Before leaving Zambie, Scott gets acquainted with some of the retirement home's other residents.
Hi.
Meanwhile, Masai has woken up. The elderly lion will soon rejoin his fellow retirees, hopefully feeling a whole lot better.
You can just see people's belongings just on the road. It is apocalyptic.
Scott has gone back to northern New South Wales, where he's heartbroken by the devastation caused by the recent floods.
I don't really get the chance to come home very often, and when I do, it seems to be tinged with sadness. Last time it was as a result of these devastating bushfires, the worst that we've ever seen, and this time round it's devastating floods which are impacting a lot of people but also a lot of animals as well.
So far, Scott has treated cows, goats and horses injured in the floods.
There we go.
But today, he's volunteering at the Byron Bay Wildlife Hospital to help native animals caught up in the disaster.
Oh wow, fancy. Hi, how you going?
Hello.
I'm Scott. Nice
to meet you, Scott. I'm Bree.
Hi Bree, how are you
Welcome.
doing? Wow, what an impressive setup. It's like a truck on the outside and like this sort of like surgical TARDIS on the inside.
Yeah.
Bree is head vet at Australia's first mobile veterinary hospital for wildlife.
Everything that you would find in a dog and cat practice, but just on the back of a truck. And so we can pick it up and we can go anywhere that we need to in times of a crisis. And we can give our wildlife the treatment that they deserve. It's a fully dedicated wildlife hospital, and as far as we know, it is the first in the world that's a registered hospital. We can do everything that a normal hospital can do, but on wheels.
And we did it first in Australia.
Yeah.
Yes, well done. That's why I'm here.
But with the flood crisis on their doorstep, there's no need to pack up the truck today.
And then straight away we've got some wildlife. Who's this guy?
Yes, so we've got a little snake patient for you. So this is a coastal carpet python, and this is from one of our flood affected areas. And so he was found trapped in some fruit netting. So we're not quite sure if he was trying to get away from flood water or he was trying to find some food because his normal food source is gone because of the floods. My heart just sinks whenever, we have a natural disaster like this, because a lot of the animals don't know that it's coming, and they don't have a plan B.
It does look like he's been caught. I can see this kind of line across the scales there.
Yeah.
And there's also another area down here as well. So I suppose the blood supply got cut off. Oh, you are beautiful, aren't you? Hey, God, he's just stunning, isn't he? Ever since I grew up in Australia, I've always really loved and admired snakes. They're such an incredible, big, long stretch of muscle, and seeing this guy slithering around my arm, it really is a privilege to do what we do, which is to help to care for these amazing animals. You're so nice, but...
We have to think of a name.
Yes. Do you have a theme going on? Because I know a lot of wildlife rescue centres, they kind of go with themes.
Yeah, so we do. We have a theme each week. And so this week, it's a French theme.
Oh, really? So
Yes.
you're Brie. So can we go for brioche?
Oh, we could go for brioche, yes.
Easy to remember then.
It is.
Hey?
Yes, brioche the carpet python.
There we go. Very fancy.
Very fancy.
Scott can tell straight away that hot weather and contaminated water has left Brioche severely dehydrated.
I've just placed a needle just underneath this guy's scales, just to help him out, just give him a little bit of hydration. It's quite surprising with patients when they come in post-flood that they actually are dehydrated. We put the fluids underneath the scales and see it float up their body. Oh yeah, look at that.
Yeah, it goes up.
It's quite an incredible procedure to do, but it is really effective in making your snake patients feel better. All right, here you go, buddy. Go on then, Brioche. Off you go.
A movement check will help confirm if Brioche's wounds are only superficial.
Oh, wow.
Isn't it amazing how they move?
So impressive, isn't it, to see them move? Looking at this snake, what I can see is just that there's the same level of flexibility and movement from the head all the way to the tip of the tail.
Yeah, I would agree. I think he's moving really well, and that the wounds that we see are superficial, and so they're just going to damage those scales, but nothing deeper. And so he's one very lucky python.
And nothing to stop him going back into the wild.
Exactly, that's what we like to hear.
No sooner has Brioche been given the all clear when local wildlife carer Kerry Ann arrives with Scott's next patient.
Hello, how you going?
Good, thanks.
Hi,
How are
I'm
you?
Scott. Very well.
I'm Kerry Ann Scott.
Hi, Kerry Ann. You've got a bin.
I've got a bin.
A garbage bin, which is a bit weird to transport an animal in, but apparently it's appropriate for the species that it is carrying. Oh my word, he's a whopper!
He is a whopper.
What's happened to this echidna?
Well, this echidna may have been hit by a car about 7 o'clock last night. A member of the public was driving. She felt the car the car wheel hit something, so it obviously was stunned at the time. Echidnas, they're stoic. They will just keep on, even if they've got broken legs, they will still try and walk and climb. I'm really hoping this one will be okay.
All right, we'll take it from here. Come on, mate.
So we've been seeing echidnas because of these flood events. They've been actually washed out of their burrows and they're ending up in places that they shouldn't be.
Look at the size of this guy.
Echidnas are pretty tough, but they're really no match for a car. A car's massive. The damage could be quite severe. They're really good at trying to grip down
Oh
and...
my gosh, wow.
Yeah. Hello.
What a legend. Oh,
He's awesome, isn't he?
that is amazing. It's like having a handful of Australia right there.
Yeah, it is, yeah. How cute is that face?
Finally getting to grips with this huge boy, it's very easy to think what his name should be. I've dispensed with the French theme and gone for Tank, because that's exactly what he is.
Something on his nose
Yeah.
that I noticed.
Oh, really?
Yeah, I don't know if it's a bubble or like a piece of tissue or something.
Yeah, I can see what you're
It might
talking
just
about.
be a bit of dirt or something like that. Their beak is incredibly soft and incredibly sensitive. It has a lot of receptors in that beak. This is how they feed, and if they lose that part of their body, then it's all over for them.
So sometimes there's a chance that you just have to put them down, you can't treat them?
Yeah, sometimes it's just too much for these little guys.
Yeah. You have got me worried now. I've sort of fallen in love with him already. So let's just hope that he's strong enough to withstand a car. Are you, mate? Hey?
It is amazing what these guys can survive from. So let's stay positive,
Yeah.
and then we can cross that bridge if we need to.
Yeah. Fractures or broken bones in echidnas are really bad news, particularly if it affects their beak, because that's used to rummage around and find food. If it's broken or abnormal in any way, it could mean that unfortunately Tank needs to be euthanized. So obviously x-rays, so we need to gas him down just to unfurl him.
We need to anaesthetise him. So there's a little trick that you can do.
Okay.
It doesn't always work.
Right.
You can roll him forward. just keep holding on to him, and you can try and roll him forward, and he may just pop his head out.
Oh yeah, I see.
And then we can stick the mask.
Oh wow.
There you go.
Oh, that's so clever. Oh,
Go
well
with
done. Great shot. Yeah, so just a little wound there, you can see, and then just a tiny little wound on the chest.
We basically go through just feeling all the joints because they can get dislocations, have a look at his eyes, have a look at his beak, his mouth, and then we'll take x-rays just to rule anything out that you can't feel, because you can't feel everything because of the spikes.
Of course.
His beak looks pretty good. He's just got some dirt in his nostrils, so that was just a bit of a
Snotty nose.
snotty nose. So he looks really good from the outside. We've really got to have a look inside and see whether there are any internal injuries which could change everything.
This is the first time that I've been able to observe a X-ray on an echidna.
X-ray.
And it is an extraordinary image. They are truly epic creatures and they really deserve the best of care. Wow, that's so cool. Well, the spines look amazing.
Detail's incredible.
Wow. So that's where you look at that and you go, that's a bird. That looks exactly like a bird's cranium.
Yeah, so quite often they'll get fractures right at the top here or down the lateral side, but it doesn't look like there's anything there at the moment. So we're just looking to see if there's any fractures along here and then down his spine and his ribs. I can't see anything that is worrying, which is really good.
Phew, thank goodness. Yeah. There aren't any signs of fracture, which is extraordinary considering he's been run over by a car. So he is truly Tank by name and Tank by nature.
Tank is definitely up there when it comes to quirky Australian wildlife.
And we all know that echidnas have a pretty impressive anatomy.
Pretty impressive penis.
Yes, pretty impressive.
3 of them in there, isn't there?
There's 4.
A 4-headed penis.
4-headed penis.
Wow, don't hear that very often.
Echidna penises are very cool. It kind of looks like a little flower, sort of, kind of in a gross sort of way.
Oh my God.
No one can compete with an echidna.
I can't, I'm immediately feeling insecure. That is amazing. Okay. Well, his chest sounds nice and clear and his heart's strong and slow. So, Tank seems like he's had a lucky escape.
So he's really lucky, and he'll go out to a carer where they'll monitor his movement and how he feeds, probably over just a couple of days. The sooner he can get back out into the wild, the better.
Wow, so it's just an awesome result. What a lucky boy.
This is what we like to see.
No, it is so amazing to have worked with these incredible vets on this incredible creature. And despite being run over, he has a few scratches, but that's it. And within a day or two, he's going to be released back into the wild, which is exactly why this hospital exists. What an icon. An Aussie spiky icon.
Scott's next patient is a flying fox, also being transported in an unconventional carrier.
I had to cut the fence with the wires. It still had the barb wrapped up in its wing, and I just slowly untangled it. It was really fine, delicate work, but I got it out.
So I call these guys sky puppies.
Really? Because you find they sort of act dog-like?
Yeah. So we wrap them up in these bat wraps and makes them feel like they're with mum, and that makes them feel secure.
And also painfully cute.
And painfully cute.
Yes.
Scott and vet nurse Lou re-embrace the hospital's French naming theme.
Yeah, it could be cute.
Pierre? Yeah, I like it. Nice. Such an incredible creature about. A lot of people are quite frightened of them as well, aren't they?
Yeah, they are. They're very misunderstood animals, but they're quite gentle and lovely.
You're a bit of a fan?
Yeah, I'm a big fan.
Are you? Oh, that's so cute. Although this flying fox is incredibly cute, we do have to be careful as vets to handle them appropriately because they can spread a form of rabies, the lyssavirus. So it is important that we wear gloves and make sure we don't get bitten or scratched. Wow. Oh, I see, look there, so right there. Hello, mate. Having the wing fully unfurled, we can see that there are a few injuries to the leather. There are some just cuts through it, but they are quite small.
These guys have the amazing ability to regenerate their membrane, either by new tissue or with scar tissue. And so a hole that size will heal on its own.
Wow. He's so lovely, but the parasites that are on him are definitely not. I really want to pull them off. Really want to get rid of them. That is gross. Look at that. These type of bats, when they're seen as patients, do have a number of mites naturally living on them. Sometimes when they're more unwell, the mites will take advantage and there's more of them. So they're called spider mites. Ugh, absolutely horrible.
Thankfully, Pierre has escaped his tussle with a barbed wire fence, relatively unscathed.
All right, buddy, you have a little rest.
Pierre will go to a carer before being released back into the wild.
Now, Lou, I can't ignore the next door neighbour.
Who is this cute little guy?
This is Malou.
And where's Mum?
We're not sure where the parents are. They're normally quite good parents and very protective, but she was just found on her own.
The noisy baby masked lapwing needs a feed, and Scott wastes no time volunteering.
Sometimes I find it easier to roll her up in a little towel to secure her.
Okay, little bird burrito.
Yeah, just because she's just going to squirm about.
So precious, aren't you? Hey?
Scott carefully uses a croc needle to feed the vulnerable native chick.
Good girl. Good girl, it's okay.
Australia's wildlife, I think, is the best wildlife. It's incredibly unique. There's nothing like it anywhere else in the world, and we really should treasure it, we really should look after it, and we really do need a good kick up the bum because we're losing it.
So important that places like this exist, and if it wasn't for this hospital, this little guy definitely wouldn't make it. Yes, looks really good. Just such an incredible looking creature. It's been an absolute delight to work at the Byron Wildlife Hospital, and always inspiring to work with Aussie wildlife and amazing wildlife warriors. But now I'd love to see Australia embracing this concept and putting these kind of mobile hospitals all around Australia. I'm very concerned about the state of Aussie wildlife, and there's not enough being done. So we all need to come together to make a real difference. Honestly, otherwise they will be lost forever.
Yeah.
Hi, I'm Dr. Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.